Well, our country is seeing a rise in cases of cancer. Lung cancer especially is the biggest contributor. Today does mark World Cancer Day. The Health Ministry is leading an awareness campaign. It's under the theme, Close the Care Gap. And this wouldn't be more important, of course, with South Africa's huge discrepancies in access to treatment. And that's exactly what eNCA senior reporter Silindelo Masikane is covering for us today. Hello to you, Slee. Let's come back to you. Earlier we heard from you and free screening and testing where you are today. What's the response been like since we last spoke?
Well, it does seem as though the community here, just after Auckland Park, which is around Westbury, has really come out in their numbers to take up this opportunity to get free cancer screenings, which are being sponsored by the Pink Drive. Of course, the Pink Drive has been doing these screenings for over a decade now, and I am joined by the Deputy Health Minister, Mr. Silindelo. Thank you so much for your time. Of course, it does seem as though that the Health Department supports this drive. Perhaps how will you be supporting this drive moving forward?
Thank you very much for this opportunity. Maybe we'll start with the reason why do we support this initiative. Pink Drive and many other partners like them, they are actually screening South Africans who, by the way, are supposed to be the responsibility of the Department of Health. So we are coming in to want to say to them, thank you very much for identifying a place and many other places that we have been doing over the past 14 years, where you screen South Africans for detection of early cancers, especially the cancer of the breast, the cancer of the cervix, prostate cancer, and all other cancers, lung cancers. So this is actually very important for us, and we are very excited when we see so many South Africans coming in forward for that, because we are now confirming that if they see today Silindelo and they screen for this cancer and it is not there or it's early lesion, we could then be there readily to clean, treat, and have a cancer-free family member for life. That's what actually makes us to be here supportive work. Pink Drive is doing what we were supposed to do anyway. But when they are here, we show our support. But there are other screening services that we are putting in here, HIV, TB, high blood pressure, diabetes, so that we can say to this one Doris Molife here, you have been screened through all these programs, and therefore there's nothing that is a high risk for you having gone through this space for today.
Deputy Minister, I spoke to the Pink Drive CEO earlier on. She mentioned an issue around a 3D mammogram machine that simply can't be put into use because of some red tape. How will you be assisting as the department?
Oh, no, we have agreed that on Tuesday, 9 o'clock, we have a meeting. She was going to bring in that supplier of the 3G machine who's not really getting headway. We will have SAPRA with us. We'll have officials of the Department of Health and go through a discussion at 9 o'clock on Tuesday. We have a meeting already set up to really make sure we go through this issue that actually she raised.
And lastly, Deputy Minister, maybe tell your message to South Africans on World Cancer Day, in terms of encouraging them to take up these services.
We want to say to South Africans, we may not be here in Johannesburg, wherever you are, go to a clinic and say, I don't have anything that I suspect as yet. These things are happening in other countries like Cuba. But can you probably check me on these issues? And we are available and ready to do it, whether you are in Da'a, whether it's Springbok, Thohoyandou, whether you're in Mpumalanga. We say, let's screen our citizens, because if we pick up that they have some lesions, some cancer that is just starting, we can be able to cure that cancer and avoid cancer that is actually very incurable. Number two, this is the reason that motivates us to say the 9-year-old girls in primary schools are being screened and given vaccine, HPV vaccine, so that when they are just getting to adulthood, 30, 35 years old, they do not then have cancer of the cervix anymore. So we are really like burning the candle on both sides, making sure we screen, prevent, but also treat those already coming with advanced lesions. So the move is, let us prevent and treat early, because then it guarantees a long and healthy life for our citizens in the country.
Thank you so much for your time, Minister. I understand you are about to go on a walkabout. I'm going to release you to do so. Thank you so much for your time. I'm just going to ask Tammy then, as I release the Minister, he will be going on a walkabout in terms of checking out some of these services that are on offer here. And you can see, of course, that we've got various stalls, like the Minister said, that you can have your breast exam done here. You can have a mammogram done, which we know can cost up to 2,000 to 3,000 rand for free. And also you can get a pap smear as well as a prostate cancer screening as well for men. I have seen a number of men, in fact, coming to take up this opportunity as well. In fact, I myself have done a breast exam as well as a pap smear. And I think moving forward, it's just something that South Africans need to be quite cognizant of in terms of ensuring that you are, monitoring your health and taking up these free services when they do pop up in their community. So, of course, we know that this particular pink drive here in Westbury will take place till around mid-afternoon. And, of course, we understand that the drive will be taking place in various other communities throughout the year.